Should healthcare be universal? Hi, my name is Whylan Rucker, and I'm a senior at Clifton J. Ozane High School. And this has been an ongoing issue for many years. Many people believe that a universal healthcare system will offer all citizens equal amount of access. Others believe it would deplete our nation's resources and cause services to be slower. Here's how people at Beaumont, Texas view the issue, including the Jefferson County pharmacists.
Watch it! You all right?
You never know when it could happen to you. A crisis occurs and you're forced to spend weeks or even months in the hospital. The first question in your mind may be, will I survive this accident? And the second question, will I be able to afford my medical expenses?
The very poor can get something. It's just the people that's in the medium that's actually, they have just enough not to have enough to qualify.
If you come down with anything, flu, diarrhea, headache, fever.
Almost half of Americans say they are worried about not being able to afford health care services.
America has the best quality health care in the world.
Right now, insurance companies spend $50 billion a year trying to figure out how not to cover people.
Basically what my plan does is it has a mandate.
Each presidential candidate has presented his or her own plan to make the healthcare system better. Some say a universal healthcare system like those established in Canada, the United Kingdom, France, and Cuba is what America needs to heal its system.
If everybody gets health insurance, the lines are going to be worse than the welfare lines.
For sure, like you say, it would cause, some chaos and some long lines, some impatience, some hostility, but the bottom line is it's to benefit everyone.
Yes, you'll have a longer lines and everything, but say for instance, if you didn't even have a line to go to, you would be in worse shape if you couldn't even have the opportunity to even get in a line.
According to the National Coalition on Healthcare, Americans spent $2 trillion on medical expenses and hospital costs in 2005. That's over $6,000 per person.
One shot every time she gets her chemo, and that one shot, that one injection is $6,000 to $14,000. I bought cars for less than that, and that's ridiculous.
68% of Americans say outrageous medical expenses have forced them to file for bankruptcy.
Paying for the prescriptions is more important than eating, and I think that's sad.
And to challenge the workforce and challenge all the drug companies that's already marketing things way above the price of what they actually could be.
According to Michael Moore's documentary, Sicko, there's a 500% markup on most prescription drugs. National surveys released say the top reason why people are uninsured is because of the high cost of health insurance.
I think it's a shame because due to the fact that drugs are necessity, and for the drug companies to jack up the prices when the poor people already can't afford it.
My wife is having a difficult time with her chemo and us paying for it. We have just one injection that costs $14,000. We can't pay for that, but we can pay a part of it, and our insurance company can pay a part of it, but the rest of it we're going to have to be in debt for.
Bill Cribbs says each injection his wife Marie takes for her chemotherapy treatment pushes the couple further and further into debt. But he is not in favor of establishing a universal healthcare system.
Universal healthcare sounds great. It sounds like it would be the answer to a lot of people's problems. But in countries which have utilized universal healthcare, it's proven not to be very effective because it dilutes the system to where the people who need it the most, the sick people, have to stand in line for long periods of time, sometimes months, to get the care they need. For those who can't afford the best health care, that's when the government should come in and subsidize on top. But there should be a little responsibility from the citizen.
It will be required by law that every man, woman, and child in America have health insurance coverage.
No more discrimination, period.
The bankruptcy of the system, that we have an opportunity to join all these players together and come up with a solution.
Opinions may vary, but the fact still remains the same that millions of people are in need of health care and something needs to be done.